There we are. So I'm Dr. Shane Criado. I'm a board certified psychiatrist and a sports psychiatrist and a sleep medicine doctor. And I wanted to do this webinar as the kickoff for what I call the pilot of peak sleep performance. It's a pilot project, a workshop that you can do anywhere in the world over several weeks to optimize and improve your sleep and thereby the quality of your lives. So I'm really excited to get started, and a little bit about myself for those who are not familiar with my training and background. So I first did physical therapy and went to med school, and then went on to do psychiatry. And in psychiatry, I noticed that people were just being given medication after medication after medication rather than dealing with the underlying cause. For example, if you have depression, it might be low testosterone, it might be sleep apnea, it might be insomnia, it might be low zinc or low vitamin D, low dopamine for any reason, lack of aerobic exercise. And so people were just being given medications rather than addressing underlying factors as well. And in my work in sports psychiatry, I work with the US Olympic Committee and the NBA Players Association, the PGA Tour of Europe, and I'm on the board for the International Society for Sports Psychiatrists. Even in my work in sports, at the most elite levels, I find that athletes are just given meds rather than addressing underlying causes, and sleep isn't even addressed until there's a real problem. Athletes focus on nutrition and mental conditioning coaching and physical training, but they always don't even think about sleep as a performance enhancer until there's an issue or they're traveling and they're jet lagged and they cannot perform effectively. That's what got me interested in sleep, because of the big overlap between sleep disorders and brain health and psychiatry. So I want to provide you the tools that you need to understand how important sleep is and know that this is a veritable fountain of youth that can affect every aspect of your health. And it's modifiable and it's free. So why ever would you not want to implement these protocols to improve the quality of your life? So I'm going to share my screen now and we will get started. Sleep is the cornerstone of brain health, as you will see, and overall health as well. I'm going to talk about the basics of sleep. I'm not going to get into the nitty-gritty neurobiology, just the very basics, so you have an understanding of why I suggest certain things when it comes to correcting your sleep. I'm going to talk about insomnia, the role of sleep in mental health, brain health, overall health, and the holistic approach I take to sleep. I remember my first day of training to be a sleep doctor. I saw the patient and I presented the patient to my boss, and he's a Harvard-trained, brilliant doctor. He said, no, don't think about all of that. You're a sleep doctor, just think like a sleep doctor, rather than me thinking about all the things that were causing this person's insomnia, everything from their gut health to their hormone imbalances to the chronic pain and arthritis they're dealing with. He just wanted me to focus on a medicine for sleep. And I didn't like that approach. And so I take the same approach I take to brain health and all my patients in psychiatry and sports psychiatry to sleep, rather than just here's some Ambien, here's some Trazodone, here's some clonazepam or Valium for you. What can we do to correct the underlying factors? If I just give you a medicine, it's like trying to put jet fuel in a broken down car. It's just not going to do it. I'm going to talk about some sleep tracking. There's a lot of popular and expensive devices, and I think they're just a waste of your money. I'm going to talk about some core sleep strategies, sleep supplements, and then I'm going to touch on the workshop, the pilot project that we're launching today. We sleep from the time we're in our mother's wombs. We are getting even dream sleep a few weeks into the pregnancy. There's two main types of sleep. There's dream sleep and non-dream sleep, simply put. And this is kind of like what we see on the sleep studies, different stages, light stages or stage 1 as you're drifting into sleep, stage 2, where you get your memory consolidation, the deep sleep, and dream sleep. Studies released this year, even in 2020, showed that deep sleep is crucial to fend off Alzheimer's disease, because in deep sleep, there's more drainage of the buildup of toxins in your brain. It flushes out the toxins in deep sleep. And so it can really help offset Alzheimer's, prevent it, or even reduce its progression. And we know that dream sleep is very important for memory consolidation. I'll touch on all of that stuff. To understand our sleep, we need to think about how we approach or should approach food. The timing is crucial, the quantity, and the quality. The circadian rhythm refers to the timing. So our melatonin levels go up at night in the absence of light, and it makes us sleepier. And as we go to sleep, our melatonin levels drop during the course of the night. And our cortisol, our stress hormone levels, kick in the early morning to help wake us up. The homeostatic drive, or your sleep thirst, refers to the fact that when we wake up in the morning, you've had plenty of sleep to drink. But as the day progresses, your brain is going further and further without sleep that particular day, if you're not napping. And so the idea is that at nighttime, by the time your melatonin levels are rising, that your sleep thirst kicks in right at the same time and helps you fall asleep effectively. We also know from studies this year as well that show that if your circadian rhythm, the timing of your sleep, is off or not in sync with your system, with your body, then it puts you at greater risk of heart attacks, cancer, strokes, dementia, sudden death, and fragmentation of your DNA. Your DNA actually shortens. It ages your brain and your body dramatically. Over 70 million Americans suffer from a sleep problem. 35% of adults, 69% of high school students in the US don't get adequate sleep. And when I talk about adequate sleep, I refer to sleep cycles of 90 minutes each rather than just hours of sleep in a day or in a 24-hour period. Because every 90 minutes, our brain is supposed to cycle through deep and dream sleep. Some people's brains, if you're 1 out of 100 people, you may need 6 hours of sleep or 4 sleep cycles. Typically, the younger you are, the more sleep you need until you hit your 20s or 30s. And then it averages out to around 7.5 hours of 5 sleep cycles for most people. But some do need more sleep and some need less sleep. With my elite athletes, I work on them getting way more sleep. So even 12 sleep cycles in a 24-hour period, strategic napping between training sessions. Sleep deprivation is a serious problem. 1 hour less of sleep, your subjective alertness drops by 1/3. We also know from a NASA study and several other studies that a 26-minute strategic nap, in terms of timing, duration, and making sure it doesn't affect any other routines, a strategic nap can boost your alertness by 34% and your productivity by 54%, which is why I separately consult with certain organizations and companies to make sure that we're optimizing their employees' sleep to boost their bottom line, their productivity, but also reducing the risk of injuries in the workplace and reducing their overall mental health burden and improving their quality of life. If we think about the statistics, sleep apnea alone costs the US $200 billion a year. Insomnia, workplace accidents, disability because of workplace accidents, sleep deprivation, sleep loss, fatal accidents, over 6,400 fatal accidents in this country every year alone because of sleep deprivation. And when we know that sleep deprivation contributes to the 5 top causes of death in the developed world, we talk about car accidents, sleep deprivation directly linked. Heart attacks, strokes, dementia, cancers. Every one of those major health issues, causes of death, are directly related to sleep disorders, direct correlations with insomnia, with sleep apnea, and other sleep disorders, totally causing losses of trillions of dollars all over the world, not just in terms of money, but in terms of the burden, the mental health burden, and the cost to healthcare. We look at the COVID pandemic right now, and there's now a tsunami of mental health problems, and now there's also a tsunami of sleep problems, and they're very closely linked, as I'll describe to you all. So insomnia is not a lack of sleep. It's actually an excessive wakefulness of the brain. If your brain is in danger mode, you're hardwired to protect yourself. Think about ancient cavemen and women through the forests in the darkness. They were afraid of animals. That's why they lived and slept in caves. And they had fires outside the caves. Caves are non-stimulating environments. They don't have windows to have the sun come in. They didn't have electric lights, bulbs, didn't have flat screen TVs in the cave, in their sleeping space, right? But we've done it all wrong. We've messed up our natural rhythms, and that's why we're paying the price. The impact of sleep deprivation on hormones is dramatic. Every type of hormone you can think of is affected. Men who get 5 hours or less of sleep every night, their testosterone levels drop to levels of men 10 years older than them. So it ages you by a decade. And your testicles will be smaller. You don't want that now. The same issues are found in women with early menopause linked to chronic sleep loss. And when I say chronic sleep loss, it's both the quality of the sleep that you're getting as well as the quantity. So if your brain needs 9 hours of sleep every night and you're getting 7 hours of sleep every night and you think, hey, that's great, 7 hours, most people get 6. Every week you're actually losing out on 14 hours of sleep if your brain needs 9 hours every night, and you can't just make that up. You're gonna have to pay the price. We know that testosterone is crucial for mental health, for concentration, for energy levels, also your sex drive, muscle development, blood pressure levels, cholesterol, red blood cell production, type 2 diabetes, and osteoporosis, all are impacted by testosterone. Inflammation is a common pathway for heart disease, dementia, cancers, and aging. We know that sleep loss can activate markers of inflammation, Crohn's disease, chronic inflammatory conditions, twice as likely to develop a relapse if they had sleep problems, and researchers recommend sleep evaluations to help predict outcomes. I say, irrespective, why wait for something to happen? Why wait for insomnia? If someone has a chronic inflammatory condition, they anyway need a sleep optimization protocol as part of their overall treatment protocol. It's really simple. Sleep predicts all-cause mortality. The shorter you sleep, the shorter your life will be. They found that another study showed people who nap, their risk of heart attacks decreases, their risk of death decreases by 37%. But you need to know how to nap and when to nap. Telomeres are the end caps of your DNA. And if you are sleep deprived over time, you will actually shorten. All right, please mute yourselves, everybody. Epigenetics. So just as we know our DNA impacts our health, we also impact our DNA. Let me just stop the sharing over here. All right, we're back. So just as DNA can impact your sleep can also actually impact what genetic markers, what genes are activated and deactivated as we go through this process. So we know that if you're sleep deprived, 711 genes are affected, are influenced, are changed. Around half of those that reduce in function help you with your immune system. So essentially, you're setting yourself up for increased risks of susceptibility to infections, even COVID. So when I work with my patients who are afraid because of COVID, yeah, masks and gloves and all that other stuff are important, but your sleep is going to be critical. And over half of the genes that are impacted by your sleep directly are upregulated, they get activated. And what do those genes do? Increase heart disease, increase risk of inflammation, and tumor promotion. So yes, sleep loss, deprivation, lack of adequate sleep, directly related to cancer. Sleep loss affects your immune system through many, many different ways. Even a small amount of sleep loss can impair your immune function, your T cells, which battle all sorts of infections, and your natural killer cells. This is a cell called a natural killer cell, which actually works to target tumors and viruses. With one night of sleep loss, the activity of this crucial first-line defense drops by 70%. So that is huge. There was another study done where these scientists, or sadists, if you want to call them, had an experiment where they actually infected people with a common cold. And they had people who had less than ideal sleep and people who had good amounts of sleep. The people who had less than ideal amounts of sleep were 3 times as likely to develop symptoms of the common cold. 3 times. The WHO has classified any form of night shift work as a probable carcinogen, which means probably cancer causing, direct correlations with prostate, breast, and bowel cancer. I usually tell this to my teenage patients because it usually works. Poor sleep can make you fat. I said that sleep impacts your hormones. Apart from testosterone, estrogen, progesterone, it can also affect hormones that regulate your weight and appetite. For every 4 hours of sleep that your brain loses out on, you think you need to eat 900 more calories. Also, if you're sleep deprived, your stress hormones go up and everything you consume gets converted to fat. And in guys, your fat cells convert testosterone to estrogen, hence the moobs. So leptin, which regulates your appetite, can't work properly. Ghrelin, which makes you hungrier, gets overactivated. Your stress hormones go up, inflammation, risk of heart attacks, deaths, cancers, dementia. So by multiple pathways, sleep loss devastates your overall health and ages your body and your brain. Heart disease. What does 1 hour less of sleep do to your heart? We know the data because of daylight savings time in this country and other countries. In the springtime, when we lose that 1 hour of sleep, there's a 24% increase in heart attacks the very next day. Whereas in the autumn, where we get that hour of sleep more, there's a 21% reduction in heart attacks. There's a direct correlation there. And why? Inflammation, stress, genetics, all those factors kick in. So I approach brain health when I work with my patients the same way that we approach heart disease. So if a person survives a heart attack and they're being discharged from the hospital and they ask the doctor, "Doc, what caused the heart attack? Was it my diabetes or my cholesterol or my nagging spouse or eating Twinkies all day?" It's usually all of the above. The same goes for mental health and brain health. If we don't address the underlying factors, we're practicing very bad and dangerous medicine. We know that chronic sleep loss through the pathways of stress, inflammation, and hormonal dysregulation puts you at greater risk of diabetes. There was a study done on healthy men in their 20s and 30s who were just allowed to get 4 hours of sleep for 6 nights, and they developed symptoms of pre-diabetes. It can be that dramatic. The good news is when they were allowed adequate sleep, the balance was restored. This is from Dr. Daniel Amen, with his permission. I work with him, and he's the most famous psychiatrist probably in the world, best-selling author. And we work with SPECT imaging, looking at blood flow and activity levels in different brain regions. And this is what a healthy brain looks like. We look at smoothness, symmetry, shape. You don't have a rainbow brain. The color doesn't matter. We look at smoothness, symmetry, shape. We don't want to see anything that looks like bumpiness or holes or divots or cracks, because that reflects a drop in blood flow and drop in functioning. So for a female in her 50s, a healthy female, this is what it's supposed to look like. On the left, the smaller image, again, is that same normal. On the right is what happens to the brain with chronic sleep loss. You see that? You see the bumpiness? The frontal lobes are affected, the sides of the brain are affected, and the top part of the brain is affected. Those areas are critical for thinking, for processing. Very, very important functions that I'll come to. So the sleep-deprived brain looks on our blood flow studies the way a concussed, head-injured brain looks like, and the way an alcoholic's brain looks like. It's the same pattern. Learning and memory. So poor sleep can devastate your concentration and decrease your productivity and decrease your memory consolidation. Medical interns who are sleep deprived or have less than ideal sleep have a 36% increase in serious medical errors. And there was a study, I think, out of Britain that compared the number of hours of sleep lost to alcohol consumption. They found that people who got just 6 hours of sleep every night, it was as if they'd consumed 2 to 3 alcoholic beverages. And people who got 4 hours of sleep, it was like they'd consumed 5 to 7 alcoholic beverages. And the cool thing is that from multiple data points, whether we do our brain imaging studies at Amen clinics, to studies out of the UK, to the overlap between fatal car accidents and drowsy driving, to understanding that when a cop pulls somebody over to test them for drunk driving, they're asked to do the finger nose test and walk in a straight line. All those things are also impacted with sleep loss. And there it goes to show. So we know that sleep is important after learning. We knew this several years ago. But recently, we found that sleep before learning is crucial because your brain needs to be like a dry sponge. And if you're sleep deprived before you learn something, it's essentially waterlogged. You're just not going to be able to retain that information. And we know that even chronic sleep loss, even 1 hour less every night over time, can lead to lower academic performance, higher dropout rates, and definitely poor athletic performance. So there were studies done on a sleep-deprived group and a sleep group, and they looked at the MRIs for activity, and they found that there was a 40% drop in the area of the brain in that activity that's responsible for memory. Imagine what happens if you're pulling an all-nighter before an exam, you're functioning at 60%. That's the difference between getting an A and failing out. It was as if your memory inbox had completely shut down on sleep deprivation. On our studies, on the left side, that's what Alzheimer's disease looks like. It doesn't mean that the brain is actually looking like Swiss cheese. It means that those areas are full of plaques and there's no blood flow, there's no activity in those brain regions. And sleep deprivation, or sleep loss due to any cause, whether it's pain causing your sleep problems or hormonal disruptions causing your sleep problems or sleep apnea or acting out your dreams, is directly correlated with increased risk of not just Alzheimer's disease, but every other type of dementia. And that's amazing because when we know that sleep is modifiable and it's free, we can do something about it. It can be one of the main strategies to stave off dementia. Dr. Amen has a list of Bright Minds risk factors, all the risk factors that impact brain health. But guess what? Every one of these is impacted by sleep. So B is for blood flow. Through inflammation and stress, blood flow is affected. Retirement and aging can disrupt your sleep rhythms, and sleep rhythms can cause your brain to age quicker and your body to age quicker. We discussed how sleep problems can impact inflammation, genetics, head trauma, and concussions. So when you are sleep deprived, your reaction times reduce dramatically. In fact, one night of sleep deprivation can drop your reaction time by 300%. So what happens to my athletes in the field? They don't see the guy coming out of the corner and they can get concussed. Toxins. Now, sleep loss can also cause a buildup of toxins, which can be devastating to you. Immunity is reduced, infections, increased risk of infections, hormonal imbalances, diabetes. I discussed all of this. So sleep impacts every one of the factors that is essential to look at when it comes to overall brain health and body health. I mentioned this, over 6,000 fatal crashes each year in this country, in the US alone, because of drowsy driving. 90% of people with depression complain about sleep issues. And when I was training in psychiatry and I'd have to pull all-nighters in the ER, not by my will, of course, one of the most important checklists I had for suicidal patients was recent sleep loss, because it's a direct risk factor for suicide. Now we know this. Has anyone been jet lagged? You know the feeling. You're going to be irritable, cranky. You're not going to want to do anything that involves mental energy, and you're going to be snappy. How's that going to play when you wake up in the morning and you've not had adequate sleep with your spouse or with your kids or at your workplace for an important meeting or dealing with that irritating colleague? As I said, with sleep deprivation, your brain functions the way it would if you were concussed or if you had had alcohol. Your rational brain, the frontal lobes, don't work effectively, and your emotional brain is off to the races. Your emotional pendulum swings very wide. So you'll have a short fuse, you'll be irritable, you'll be quick to anger. And additionally, your ability to pick up on social cues will drop dramatically. You're not going to be the best communicator. How does sleep impact mental health? I mentioned to you that sleep impacts your brain directly by shutting your frontal lobes down. The frontal lobes, the front part of your brain, help you with attention, concentration, executive functioning, task organization, planning, multitasking, motivation, drive, social connectedness, rational thoughts, suppressing your impulses. And your temporal lobes help you, in addition to regulating your emotions, new learnings, memory consolidation, where the hippocampus is that you saw earlier. Those are the direct impacts of sleep on brain health. And then the indirect facets are the Bright Minds risk factors. What does sleep do to mental health? Well, it can worsen your anxiety because of your stress hormones being released in higher numbers, your ability to regulate your emotions reducing. So your rational brain shuts down, your emotional brain is off to the races. ADHD, a lot of people in this country and others who are sleep deprived are misdiagnosed with ADHD and put on stimulants, which causes their sleep to be messed up even further. It's like, as I said earlier, pumping jet fuel into a broken down car whose gearbox isn't working anymore. Sleep can directly impact depression. We know that already. We just spoke about it. Even one night of sleep deprivation can trigger a manic episode. And sleep deprivation, less and less and less sleep, can actually trigger a depressive or a manic episode in bipolar disorder. There's something called Jerusalem syndrome, where people visit the Holy Land and they may not have slept on the plane. They get off the plane and go barefoot and take the sheet from the seat, put it on themselves and call themselves Jesus. It's called Jerusalem syndrome because that one night of sleep deprivation has made them psychotic. And the Israeli authorities know about this really well. They don't put them in jail or hospitalize them. They send them on the next plane back to the US. And because they're sleep deprived, they already get adequate sleep on the plane ride home. And they wake up back in the US, fine as a fiddle, but wondering why they didn't get to go on their vacation. Sleep loss can also impact PTSD symptoms, post-traumatic stress disorder. One of the main symptoms, some of the main symptoms of PTSD are nightmares, flashbacks, easily startled, hypervigilance. It's like your emotional danger mode circuits are frozen. And sleep loss will perpetuate and worsen that. Additionally, people who get nightmares want to avoid sleeping as long as possible, but actually fuels more nightmares because the more sleep deprived you are, the more quickly your brain wants to drink up as much dream sleep as possible. So you'll be having more nightmares by doing that. We know that your rational brain shuts down, your willpower reduces, and your emotional circuits, your irritability increases when you're sleep deprived, and it can trigger substance use and substance abuse. And we know that a lot of psychotropic medications, sleep medicines, can impact your mental health. Sleep medicines can result in, certain ones can cause more depression, more restless leg syndrome. Most of the antidepressants we use can worsen restless leg syndrome. Over-the-counter sleep medicines like Benadryl can increase your risk of dementia and also restless leg syndrome. This pyramid is stolen from my book, my first book, Peak Sleep Performance. It explains my approach rather than, oh, here's some Ambien for you, looking at every single underlying factor. Level 1, we start at the base. What sabotages your sleep? Level 2, how do we track your sleep effectively? Level 3, what are some of the core strategies to synchronize your rhythms the way that you were designed to sleep? And then level 4 is optimization, the stuff that I work with my elite athletes on, companies, CEOs, to use your sleep as a secret weapon to boost performance. So, can mental health problems impact your sleep? Definitely. Anxiety, danger mode, sleeping is the most vulnerable thing you can do. So if you're in danger mode, there's no way in the world you're going to be able to fall asleep. Then you'll be trying and thinking and worrying and then associating the bed with worry. It's going to cause a vicious cycle that leads up to sleep fragmentation. And then even fear. Your bedroom is supposed to be your safe space, your cave, like I mentioned at the beginning of this talk. But now our bedrooms are extensions of our living rooms. We have TVs and gadgets and all sorts of things in the bedroom, and that will destroy your sleep. If you have ADHD, attention deficit disorder with a racing mind, you're going to have a hard time falling asleep. Depressive disorders, you're going to stay in bed way too long. Moping, lack of motivation, is going to cause you to associate the bed with depressive thoughts and further disrupts your sleep. We know bipolar disorder can directly influence insomnia, even when your mood is stable. PTSD, because of the hypervigilance danger mode, it's going to affect your sleep. Substance use, well, alcohol can cause middle of the night awakenings and worsen sleep apnea. Uppers like Adderall, cocaine, those kinds of things can destroy your sleep. You'll get less sleep. And medications like benzodiazepines, heroin, the downers can cause you to sleep more, stay in bed longer, be lazier, and worsen sleep apnea. A lot of psychotropic medications cause weight gain and devastating impacts to sleep. We now need to know that if anyone has a mental health disorder, they need to have separate approaches to their sleep, not just a medicine to cover that. So I've told you about, we've touched on underlying factors that impact your sleep. There's always chronic pain I need to think about, hormonal imbalances, toxin exposures, substance use, meals, timings of your day, how you structure your routines. Those are all things that directly impact your sleep, yes, but there's also certain sleep disorders. And insomnia is a diagnosis of elimination. It's oftentimes a symptom of several underlying factors. We correct those factors, the sleep will improve. So insomnias are a separate category of sleep disorders. Breathing disorders like sleep apnea. Excessive sleepiness. So some people get adequate sleep, good quality sleep, but they have narcolepsy or something like that, and their brain simply needs more sleep than the average person. And narcolepsy is not simply a medication management kind of thing again, because recent data shows that if you have narcolepsy and say you need 12 hours of sleep in a 24-hour period to sleep well and feel refreshed and function well, and you're not getting that, it also ages your brain, like I mentioned, the shortening of your DNA end caps, inflammation, obesity risk, heart disease, cancers, strokes, dementia. And so rather than give them a wakefulness agent or a stimulant, it's my job to educate my patients about strategic napping. It doesn't mean you're lazy. It means you're healing your brain and staving off aging and those horrible conditions I just mentioned to you. Circadian rhythm disorders. Are you a night owl or a morning bird? And if you are a night owl, can we shift your rhythms? The answer is yes. We can correct your rhythms over time, even if your natural inclination is toward a certain kind of sleep schedule. Every cell in your body has its own clock. It's a beautiful thing to think about. And if your rhythms are slightly altered from what your natural rhythms are, your quality of sleep will suffer. And again, the cascade of catastrophe with aging, DNA fragmentation, inflammation, dementia, heart attacks, strokes, and cancers. Parasomnias are abnormal movements in bed. You're not supposed to act out your dreams. You're not supposed to walk or talk in your sleep. I've had a few patients who are actually having seizures at night, which caused part of their brain to wake up and they were sleepwalking and sleep talking. So it can mean a serious issue if we don't know what to look for. I've had a few patients as well who were diagnosed with schizophrenia in my psychiatry practice, who had seizures that were causing the hallucinations. You correct the seizures, those so-called psychotic symptoms resolve. These are all the factors that can sabotage your sleep, the bottom of that peak sleep pyramid that I mentioned. What do? I don't want to give someone Ambien or hey, here's some trazodone for your sleep. I want to do a complete blood panel, looking at everything that can impact it. Even your gut is critical for your sleep and your brain health. The gut is referred to as a microbiome. You have around 100 trillion bacteria in there. And the gut is important in many, many, many ways for your sleep. There are healthy bacteria that rely on our vitamin D to produce our B vitamins. And our B vitamins are critical for red blood cell development, for oxygen carrying capacity to the brain. B6 and other B vitamins are critical in nerve and neurological development, brain health. For example, B12 deficiency can result in subacute combined degeneration of the spinal cord. Degeneration. Folate is critical for nerve development as well. So if you don't have sufficient vitamin D, your vitamin B level will suffer, your healthy bacteria will die off. Your gut also produces 75% of your neurotransmitters, like dopamine, serotonin, epinephrine, adrenaline, not your brain. So your gut produces most of your neurotransmitters. If your gut isn't working right, your brain isn't going to work right, and your sleep will be messed up. And if there's more inflammation in your gut, because you're sensitive to certain foods or you're bloating or gas, that needs to be fully addressed, because inflammation is then going to be the common pathway to what I told you: heart attacks, strokes, deaths, dementia. By those cardinal mechanisms, the gut is critical in looking at your overall sleep. We know that infectious diseases, Lyme disease, other diseases like Rocky Mountain spotted fever, certain chronic viral illnesses can all impact your sleep. Porphyrins are basically the vampire disease, sensitivity to light, peeing blood in the urine sometimes, more anxiety affects your sleep. Sleep trackers are a waste of your money, in my opinion. That's the bottom line. I prefer the standard sleep diaries, and that's why when I do workshops, work with patients, I have them fill out sleep diaries every morning as an estimation, because these devices cannot accurately differentiate between dream sleep and deep sleep. I've looked at studies. There was one study that compared 10 tracking devices. They could accurately differentiate between dream and deep sleep 3 out of 10 times. So that's worse than flipping a coin. So fatigue is different from sleepiness. When I ask patients whether you're fatigued or sleepy, they're like, huh, what's the difference? If you've run a marathon, you're tired, you're fatigued, you're not sleepy. Sleepiness means you're nodding off. So you need to get into bed only when you are feeling sleepy, not when you're feeling tired, because otherwise your brain is going to be very busy and keep getting activated. And you wonder why. It's because you're tired, you're not sleepy. I mentioned the quantity, quality, and timing of sleep. Your total sleep need, sleep cycles, not hours. And sleep hygiene, you can Google it, you find a whole list of random recommendations. It's weak, it's not effective, it's too generalized. They say don't nap ever. I work with strategic napping with my patients, and the right way to nap, because it can reduce your death risk by 37%. Sleep hygiene tells you, okay, if you can't fall asleep within 20 minutes or so, get out of bed. What if you're elderly? What if you have mobility issues? You're going to fall and hit your head. Clock watching is a bad idea because it's going to activate your brain in the middle of the night. And sleep hygiene does not address the underlying factors the way I do with my patients. CBT for insomnia, cognitive behavioral therapy for insomnia, is the gold standard treatment for insomnia once you've addressed the underlying factors. Now, most sleep doctors are not trained in this, and most people who do this are few and far between, and they're not doctors. So there's a terrible chasm when it comes to sleep medicine. One of my mentors once told me, we don't treat insomnia as sleep doctors. That's for primary care docs. That's for family medicine docs. That's for general practitioners. I'm like, no, insomnia is our bread and butter. So once you rule out the underlying medical factors as a medical doctor, as an integrative psychiatrist or sleep medicine doctor, cognitive behavioral therapy for insomnia is the gold standard. It involves correcting negative thoughts, associations, and bad behaviors, sleep behaviors, to consolidate your sleep cycles. I had asked for separate training and received separate training in this. Sleep is the best meditation according to the Dalai Lama. And as I mentioned earlier, if your brain is in danger mode, you're not going to be able to calm it down and fall asleep. Medications for the long term are dangerous when it comes to sleep. They stop working quickly. You can get addicted. Over-the-counter sleep medicines like Benadryl can block a neurotransmitter called acetylcholine, which is critical for brain health. And if you block it, it sets you up for increased risk of dementia. You have the hangover effect with medications, and most of the sleep medicines in this country have a black box warning for dangerous behaviors potentially leading to death. Do you really want to be taking that kind of medicine to put a Band-Aid on a festering wound? I hope not. Here are the best sleep supplements that I like. And I've also written the doses because it's not just about, oh, this food has some turmeric in it, maybe it's going to be good for me. Just like your prescribed medicines, antibiotics, you need the right dosing. And each one is sensitive to different doses of different meds and supplements. And it's always a combination strategy, not just meds or supplements, also thought and behavioral strategies, cognitive behavioral therapy, and also the underlying factors that I was talking about all this while, and also the mental health factors. Just like exercise needs to be a prescription, not like, oh, exercise is good for you. What's the prescription for different brain regions? Similarly, here are some of the ranges of doses that I use with my patients. And these are my top supplement choices. Melatonin, very low doses, as you can see, 0.5 to 3 milligrams, 60 to 90 minutes before your desired bedtime. Melatonin is not supposed to knock you out. It's supposed to nudge your brain into sleepiness. And people take whopping doses, have hangover effects the next day. And if it works in your brain, it can have devastating impacts in overdoses or excessive doses. That's why I advise my patients who have insomnia or sensitive to light, especially, to dim the lights at home at night. Maybe it's romantic for you and your partner. Or wear dark glasses around the house at night. Pretend you're Bono from U2. It's okay, because it's going to allow your natural melatonin levels to rise and nudge your brain into sleepiness the way it's supposed to. Your brain is not a light bulb. It cannot just switch on and off. You need to have a nice calming winding down routine to train your brain to get into sleep mode, to allow it to fall asleep, not try to sleep, because trying will wake it up some more. So anyone who has an inkling of an underlying factor impacting their sleep, whether it's sleep disorders like sleep apnea, or acting out their dreams, or excessive sleepiness, drowsy driving, pain, mental health issues impacting their sleep, they need to work with a doctor like me. I also not just address problems, I work on optimizing people's sleep. That's why I wrote my book that's behind me, Peak Sleep Performance, to use your sleep strategically to boost your quality of life in every facet of your existence. But if you do have any warning signs, please see a doctor. So before I wind up, I want to tell you that chronic sleep loss, poor timing, poor quality sleep is going to be like a leaking pipe, going to trickle down and infiltrate every aspect of your health, down to your very DNA. And you can't just withdraw and function on less and less and less sleep. You'll be running on fumes, and you're going to have to pay that price. I don't want to scare you. I want to empower you. I want to give you the tools that you need to weaponize your sleep. That's why these resources are available to you. My book, Peak Sleep Performance, is on Amazon and Kindle. I'm so grateful for the opportunity and everyone who made it possible. It debuted #1 in sports medicine on Amazon in March of this year. And you can reach me or follow me on Peak Sleep Performance, email me directly. It's a YouTube channel that I haven't really invested in right now, but I will. But the Instagram account is where I give people updates on talks, sleep tips, strategies, performance. I want to thank each one of you for making it today. And I'm going to stop sharing my screen and take questions before I dive into the workshop that we are launching today. Thank you.